Well, thank you, Mr. Chair, and I want to thank you and our ranking member for this hearing, and to our nominees. Thank you both for being here, for your willingness to serve, for the service you've already provided to your country and your state, and to your families, too. And I want to associate myself with everything that Senator Whitehouse just asked you about, and will just say that I know Senator Bennett asked about the implementation of surprise medical bills. I think that the passage of that legislation to end that practice was an example of really patient-focused policymaking, right? And so I would look forward to working with you both as we implement that provision and find further ways to really look at our healthcare system from the patient's perspective. And I appreciate very much your willingness to do that. Ms. Palm, I wanted to start with a question to you. As you know, the COVID-19 pandemic has exacerbated the ongoing substance use disorder crisis in the country. It's critical that Congress and HHS work together to ensure that states receive the funding that they need to support continued access to substance use disorder treatment and services. Over the past several years, state opioid response grant funding has allowed New Hampshire to dramatically expand access to opioid use disorder treatment and services for granted staters. But under the current funding formula, a significant portion of New Hampshire's state opioid response grant funding is now at risk. I'm working to ensure that states like New Hampshire do not face dramatic funding cuts that would devastate opioid use disorder treatment programs. Will you commit, Ms. Palm, to working with Congress to ensure that states do not face dramatic cuts in state opioid response grant funding?
Senator, I'm so grateful for your leadership on this issue, and considering what we've seen with the pandemic, we were making such good progress, and we've got to double down, and it's critical that states have the funding that they need to continue to provide treatment for opioid use disorders.
Thank you very much. Ms. Brooks-LaSure, I want to turn to you, and I just want to say that I have two of the most eloquent colleagues in the world, Senators Menendez and Casey, when it comes to talking about home and community-based services. So I'll associate myself with their comments about the importance of it. We know how important it is to individuals and families to have the choice to get their long-term care at home among familiar faces in their community, and a chance to really interact with their loved ones and control their care that way. But I want to drill down on a couple of things. Unfortunately, many individuals who receive care in home and community-based settings have really faced unique challenges accessing, for instance, COVID-19 vaccines. And we know that home health workers have struggled to access the personal protective equipment and COVID-19 testing that they need to do their jobs safely. Just as we saw other disparities really highlighted by the pandemic, this disparity in terms of being either a home health care patient or a home health care worker has really been exacerbated too. So following up on the commitment you made to Senators Menendez and Casey, as CMS administrator, how would you work with states to better support home health care workers and individuals who receive home and community-based care during the COVID-19 pandemic?
Thank you, Senator. This is, as you've raised and the other senators have raised, is such a critical issue. We want to make sure that people are in the setting that makes the most sense for them, and if confirmed, you certainly have my commitment to make sure that CMS is doing everything it can do, whether it's approving waivers or working with states to address issues. And I'd love to follow up with you on this particular point.
Well, I would look forward to that as well, because it continues to be a really serious issue. I have one more question, and it's to Ms. Palm. As the Secretary of the Wisconsin Department of Health Services, you emphasize the importance of health data infrastructure in expanding access to COVID-19 testing. With the continued emergence of COVID-19 variants, ongoing surveillance and health data exchange will be essential for tracking emerging variants and mitigating community spread. If confirmed, how will you leverage the tools at CMS or throughout the department to incentivize health data modernization and improve data exchange?
It's such an important question. I think more broadly, our data infrastructure, our technology, our modernization of the way we think about surveillance and data is critical, and it's a place where HHS can and should help be a leader, so that we are learning the lessons of what our data infrastructure could do and couldn't do, what we needed it to do, where we could partner with the private sector to really maximize our ability to understand community spread in the example you gave, and how that helps us get in front of the next surge or the next community who is facing an outbreak. And so there's a lot of opportunity there, and I think we really have to be focused, learn the lessons, and drive that into the next iteration of how we work on data and the transparency of that data moving forward.
Thank you very much. I look forward to working with you on that.